Let's take you to China now, where it has recorded its highest number of daily COVID cases since the pandemic began, despite the country's zero policy measures designed to eliminate the virus. The National Health Commission recorded 31,444 locally transmitted cases on Wednesday, surpassing the previous peak of 29,317 recorded during Shanghai's lockdown.
China has reported a record number of daily COVID infections as a nationwide surge in cases heaps pressure on the country's increasingly zero-tolerance approach to the virus. On Wednesday, Beijing recorded its fourth COVID-related death since last weekend, alongside 1,648 local infections. Earlier this week, schools in several districts moved classes online, while Chaoyang, epicenter of the city's outbreak and home to many international businesses and embassies, urged residents to stay at home. Meanwhile, protests erupted this week at the world's biggest iPhone assembly factory. Videos on social media showed workers confronting riot police after authorities attempted to lock down the facility following an outbreak. Fueling the anger of citizens trapped in lockdowns are recurring issues like being unable to access prompt medical care or secure enough food and supplies, or losing work and income. China, the world's last major economy still enforcing strict zero-COVID measures, announced a limited easing of the policy earlier this month. Following the announcement, several Chinese cities cancelled mass COVID tests and classification of restricted high-risk areas, scrapped quarantine requirements for secondary close contacts, and reduced quarantine for close contacts and international arrivals.
Let's talk this through by speaking with Professor Iwale Tomori, who is a virologist and joins me from Ibadan here in Nigeria. Thank you so much for joining us on the news this time. It does feel strange to have a conversation on COVID-19 at this time when it appears at least Nigerians have moved on from the pandemic, and you find that in such a developed world as China, three people actually die in every million to the extent of being locked down. Help us understand what exactly is happening.
Thank you very much. I think the message for us is that COVID is not gone. It might have slowed down, but it's still occurring in any place. And I think the message for us is, we look at what happened with polio. Africa has been declared free of polio. And then just about a few months ago, Malawi and Mozambique got polio from Pakistan. So I think that's a message for us here, that we shouldn't let down our guard. It's still occurring in China, even despite all their serious method they're doing, lockdown and everything. They reported, just like you said, 31,000 cases in one day. So it's there, and we should be wary. We have let down our guards in Africa and other parts. We never really suffered that much from COVID, but doesn't mean that it's not there. I think we should be careful. Keep those basic things that stop transmission. We should begin to do them. Go and get vaccinated, And when you're in a big crowd of people, please try and protect yourself.
Well, with this news coming from China, could there be another COVID-19 pandemic wave that could send the world into a shock as did 2020? Or what do you worry about most?
I worry about the fact that the diseases don't obey the laws that we give to them. They behave on their own. I mean, when the thing started in Wuhan, nobody thought it was going to be like this. And then suddenly it goes on, it comes back. It goes on, it comes back. So we should be wary. And that's the message I think. None of us can predict what is going to happen with what is happening in China. But I think the message I think we need to know is that so long as these diseases occur in any part of the world, we are also vulnerable. And only those who are protected, who are vaccinated, or who participate in the non-pharmaceutical preventions will be safe. So please go and vaccinate, get yourself ready in case it comes into the country. Nobody can predict what's going to happen. A new variant will come that will cause all the all the trouble that we're having in the world now.
Well, talking about vaccination, China has actually refused to import vaccines despite evidence that its homemade jabs have not proved as effective. But President Xi Jinping argued that lockdowns are needed to protect the country's large elderly population. Do you also share the same perspective?
First of all, China has the right to decide on what it wants to do. If it's producing its own vaccine, then it should use its own vaccine. I mean, that's one thing. I mean, it's only in Africa we are not, we don't know what we want, that we take everything from everybody. So if China decides, and yet when you look at the figures of China, what are you talking about? China is 1 point something billion. Nigeria is 260 something. They have, so far, the number they have is about 256,000 cases. Nigeria has 231,000 cases. So what are we talking about? With what they are doing, they are putting their numbers down. For a 1 point something billion people having 250,000 cases and 200 million people having 231,000 cases. You know, we're talking different things. So their system is working.
Yeah, well, so the world has actually moved on. You know, what China's zero COVID policy has, clearly saved lives. It has also dealt a punishing blow to the economy and ordinary people's lives. And this was or has been a similar experience for other economies of the world. Isn't it possible for China to move on and live with it like the rest of the world?
Well, you see, again, that comes into the kind of leadership we have. You made a good point now that with their system, they saved many lives, much more than other parts of the world saved. Go and look at America with all this liberal system. They are talking in millions of people dying compared to China with bigger population that is only talking about 250,000 people dying. So balance it up. And you see, it's not a matter of, it's the figures. But if China is using that system, yes, of course, it has a lot of effect on the economy. But is it life or is it economy? If the people are dead, what is the economy about? So you have to balance on those things and take what side suits you. Each country should be able to decide on its own and say, look, this is the balance we have. You want to lose more life or because of economy or something of that nature. So it's a matter of balance. And each country must take up its own mind to do what it wants to do, not wait for Western world to determine for us what direction to do. Let me give you a good example. When the whole COVID thing came, we were waiting for Europe to decide for us. And older people were dying in Europe, which was not the situation here because our population density was different. And therefore, we should have used our own economy, our own epidemiology to determine what to do, not follow the Europe or whatever it is and do a blanket lockdown when in actual fact, we didn't need it.
Yeah, well, we hope that people like you will keep lending their voices to ensure that Nigeria and, of course, the rest of the world, African nations, tend to keep doing the right thing. A virologist, Professor Iwale Tomori, joining us from Ibadan on this issue. Thank you so much for your time, Prof.
It's my pleasure, sir. Thank you.